Hi, I'm Hannah Wasland, and I'm going to be presenting my paper to you guys. The topic that I chose is obesity in America. So, over the last 20 years, obesity has been more and more prevalent among adults in the United States. The latest data from the National Center for Health Statistics shows that a third of the United States adults 20 years and older, that's over 100 million people, are obese. In the youth, 18% of children 6 through 11 and 20% of teenagers 12 through 19 years old are considered obese. The rate of obesity is taking a big toll for Americans' health. So, issues that arise from this is basically hypertension, um, or high blood pressure, dyslipidemia or high cholesterol, type 2 diabetes, coronary heart disease or risk of heart attack, stroke, gallbladder disease, arthritis, sleep apnea. It can even cause certain types of cancers like endometrial, breast, or colon cancer. There have been abnormal findings in ECG or electrocardiograms and obesity. Most of the abnormalities are reflected by alterations in the cardiac morphology. So, in these findings, it has been shown that there's been a leftward shift of the P wave and QRS and T wave axis, various change in P wave morphology, low QRS voltage, various markers, or left ventricle hypertrophy, T wave flattening in the inferior and lateral leads, lengthening the corrected QT interval, and prolonged QT interval duration. Basically, being obese highly impacts your heart, and it is shown through getting this test done because it tests your heart, and it's harder to have your heart function well when you have all of that weight. So, obesity is caused by a number of things. It's not one thing. It includes diet, physical activity, genetics, and medical reasons. So, the underlying cause of obesity is eating too much and not being as active as you need to. But there can be other causes to this. So, the energy value in our food is called a calorie. And for the average active man, you need about 2,500 calories for a day. And for the active woman, you need about 20 or 2,000 calories a day. So this may sound like a lot, but if you're active, you are burning these calories. However, depending on the food that you eat, some of these, like some meals can take up most of your food for the entire day. For instance, if you go to the fast food place and get a hamburger, a shake, and fries, you're probably going to have about 1,500 calories, which for a woman that's about 75% of your calorie goal for the day. So definitely keeping an eye on that is something that can prevent obesity, and eating fast food just is not good for you. Um, so lack of physical activity is responsible for obesity. Even though you can't really out exercise an unhealthy diet, it does have a lot to do with being healthy. Um, in our day and age, most of the things that entertain us are done on a small screen where we are able to remain completely immobile. So it's good to find things that you enjoy to do. If running on a treadmill for an hour isn't your thing, try taking up a sport that you may like tennis or soccer, and then you'll be more apt to be active. Um, And then genetics are responsible for weight gain as well. Sometimes genetically it's just harder. And then medical reasons can involve hypothyroidism, which is underactive thyroid, or Cushing syndrome, which is a condition where your body produces a lot of steroid hormones. So, obesity is so widespread. Everyone is trying to find a cure other than living a healthy lifestyle. Some of these methods are used, some of these methods use medicine, like orlistat, lorcaserin, topiramate, bupropion. These have a high impact on your nervous system and reduce your appetite. And weight loss surgeries are also a big way in trying to help people who are obese, like lap band, gastric bypass, which basically just reduces the size of your stomach, therefore reducing your appetite. Although these surgeries and medications help with weight management, there is a better alternative, and that's taking preventative precautions. This basically just includes trying your best to live a healthy lifestyle, not overdoing it and setting a diet that the goals are going to be too out of reach, but something that you can stick with. It's not bad if you have ice cream now or then, or are lazy a day, but it's keeping the lifestyle of it that is going to make a difference. Something that I have learned, eating a lot is one of the causes for obesity, and I've learned that after eating, if you still feel hungry, set a timer for about 15 minutes, and by the time the timer is up, you might feel full and not want anything to eat. That is because your satiety or feeling full doesn't really kick in until then, because your body hasn't really registered that you have eaten food. And sometimes we all eat too fast. So, overall, maintaining a healthy lifestyle that you can manage every day and taking steps to prevent unhealthy weight gain or health problems and to promote a healthy life. Thank you for watching, and I appreciate all of your feedback.